Greetings, Ohio Valley. This is Dan Lima with OSU Extension from Belmont County.
And this is Karen Cox from WVU Extension in Ohio County. Thanks for tuning in to Extension Calling, your source for research-based information for the farm, garden, and home. COVID-19 vaccines are available to West Virginians in all 55 counties. To find COVID-19 vaccines near you, visit vaccinate.wv.gov. You can also call the West Virginia COVID-19 info line at 1-833-793-0965. Again, that's vaccinate.wv.gov or 1-833-793-0965 to find your COVID-19 vaccine. Dan is away on military leave right now, so we're going to bring back some of our previous shows that didn't make it to the podcast. We hope that you enjoy them. As always, we welcome your feedback. If you'd like a written transcript of the show, please email me at Karen, Karen, .cox, COX, at mail, mail.wvu.edu, or call 304-234-3673. Thanks again for listening.
One of the subjects I want to talk about today is an invasive insect that we get to look for and deal with. And this time, this insect does not just bother plants and trees, but it will affect our livestock and our pets, and potentially us as well. The longhorned tick has been determined to have been in the United States since 2013. However, it wasn't officially identified until 2017. It is a dark brown tick, like most of them, but it grows to the size of a pea when it's full of blood. Their stages of the tick are very small, a poppy seed or smaller. Always remember it's those little teeny tiny ticks that are the ones that are the greatest disease vectors, mostly because we don't recognize that they are attached. Now, we're not sure how the tick came over. However, we do know that this particular tick is somewhat like an aphid in that it can reproduce without a male. So a single female tick can create a whole new population in a new location. So just one tick can cause a new population growth in an area. So we really need to start watching for our ticks, or watching our animals for ticks, especially when we're transporting them. Now, right now, they have not been determined to transmit any livestock or human diseases, but in other countries, anaplasmosis, babiosis, ehrlichiosis, thaliariosis, and rickettsiosis, and several viruses are carried by this particular tick. So what we want to do is we want to do everything we can to make sure that we're protecting ourselves and our livestock and our pets to avoid having a tick bite them. So obviously, if you have pets or livestock, you need to be talking to your veterinarian and talking to them about which tick prevention devices are best for your situation. Also, tick prevention practices include keeping your grass and weeds trimmed, clearing away random brush, and that can apply for yards as well as pasture fields. Now, if you find a tick attached to an animal or person, you should remove it immediately using fine-tipped tweezers if possible, or a tick prior, which is a little split-ended piece of metal that you can use to pry up the tick. It is very important that you do not squeeze the tick or smother the tick or otherwise try to scare the tick or damage the tick. You're going to grasp the tick as close to the skin as possible. Pull upward with steady, even pressure. Don't twist it as you remove it, because this will cause the mouth parts of the tick to remain in the skin, and that can increase your risk of infection. And also, if you try to suffocate a tick while it is still attached to you, basically what you're going to do is you're going to scare the tick. And that is going to cause the tick to have this wonderful reaction where it regurgitates on command, and all of the bacterium and viruses that are inside the tick's body are now in your body. So it actually increases your chances of contracting an illness from the tick or an infection from the tick if you try to smother it. And that includes alcohol, nail polish, using a match, all sorts of those home remedies. None of them should be used other than gently prying the tick out of the skin. Once you have removed the tick, I want you to put it in a Ziploc bag and seal it, and then hang on to it. If you start showing any symptoms of, like, say you get a fever or you're just not feeling well, you're really, really tired after being bitten by this tick, then you want to take this tick and get it tested. A lot of times you're going to experience symptoms before a test result from a tick can come back. So it's not always advantageous to test every single tick that bites you. Another thing to keep in mind is that in order for a tick to transfer a disease, such as Lyme disease, it needs to stay attached to the skin for over 24 hours. If you find the tick shortly after leaving the environment where it found you, then it is much less likely that it's going to transmit a disease to you. So always do your tick checks when you get back inside, and always remember that you need to check everywhere, not just your hairline, but everywhere. They typically like nice, warm, moist places, armpits, and those other sweaty areas that no one likes to talk about. Those are great opportunities for ticks to hide, and no one wants to look there. So don't let your bashfulness prevent you from checking yourself thoroughly to make sure that you do not have a tick the size of a pinhead hiding on you. Another thing you can do is just basically prevent the tick from getting onto you. Preventative measures should include spending less time in tick-filled habitats. But if you are an outdoorsy person or you work on a farm, that gets kind of difficult. So we know that we have a lot of ticks in this area, and they tend to like the places where we have to work on farms. So what you want to do is you want to wear light-colored, full-length clothing whenever possible, and you want to cover the exposed skin surfaces with DEET repellent, at least 30% or greater. So if you don't want the DEET on your skin, sometimes you can just put it on your clothing. However, if you are going to be in a tick-infested area for an extended amount of time, the balance between the dangers of using DEET on your skin and contracting Lyme disease or Rocky Mountain fever or any of those other diseases that ticks carry, I really think that the DEET is the lesser of the evils. As long as you wash DEET off within 24 hours, it's not going to get absorbed into your system and it won't collect over time. So make sure that you are washing yourself after being out in these tick-infested areas. Wash regularly. If you're camping, you still need to make sure you're doing tick checks. And if you have put DEET on your skin, you do need to wash it off. So a camp shower, a bottle of water with a sprayer on it, any of those things could work. But light-colored clothing is really important because it allows you to see the ticks on your body. They're typically a darker color, and they can show up much more easily. Also, if you tuck your pant legs into your socks, it will keep them from crawling up under your pants and into the places that it's harder to check for them. So you do want to try to tuck in your socks, tuck your pants into your socks. And again, if you are going to be in a very tick-infested area for an extended period, you can use a pesticide called permethrin. Permethrin is very good for repelling ticks. It actually makes them turn around and go back to where they came from. And it is an excellent repellent, but you do not want permethrin on your skin. So you should wear your personal protective equipment while you are putting it on the clothes that you're planning to wear outside. Let those clothes completely dry, and then you can wear them. It's really good, but you do have to follow all of the instructions on the label because it's just not good for you to have on your skin. We'll put it that way. All right, so you also always want to check yourself a couple times during the day. Just, look around on your outdoor clothing and see if you've got anything crawling on you and flick it off. That's going to be helpful. If you have any sleeping bags or blankets from camping, you want to make sure you're putting them directly into the washing machine with a hot water wash, or you're going to seal it inside a plastic garbage bag to kill any unattached hiding ticks that could come into your home once you get home from your lovely trip. All right, so some other things you want to do is make sure that you are keeping your pets' tick propellant treatments up to date. Make sure that you are, wherever they're sleeping, that you're paying attention to their bedding area, and that you are keeping any grassy areas that they might be spending excessive time in mown and cleaned up. Also, make sure that you are checking your pets when you get back. So not only are you going to do a tick check on yourself, but you're going to do a tick check on your dog or whatever other animal that went with you. Again, using tweezers or a tick removal tool, or your fingers protected by a tissue or a baby wipe or something are going to be very beneficial. Make sure that if you find them, they are gently removing the tick that is attached to you. A lot of times you're going to do all of these tick checks, and then 10 minutes later you're going to find a tick crawling on you, and that happens, and then you get the creepy crawlies for the rest of the day. But do still check. I mean, sometimes they're really weird to find. They get caught in your hair. They hide in little crevices, and I know when I have been out in the woods for extended periods and I've come home and showered and gotten ready for my other job, and then I still would find ticks crawling on me. So they're really hard to get off in a shower. So do make sure that you are scrubbing with a washcloth. If you find any dark spots that you aren't sure of, that you can't really get a good look at, get a friend or a spouse to look at it and make sure that it is not a tick attached to you. If you want to be extra precautious, you can use some masking tape with the sticky side out, right at the top of your socks where they connect with your pants, and that's going to help you. It's going to be like a sticky trap for a greenhouse where you are just investigating, okay, how many ticks are out here, and how careful do I need to be on my tick inspection. So also, of course, this might go without saying, but you want to avoid wearing open-toed shoes, sandals, flip-flops, and also don't sit on the ground or logs in brushy areas. Try to stay in the center of the trail when you're hiking. Ticks like to climb up those tall weeds that are along the edge of the trail and jump onto whomever or whatever is walking by. All right, so another thing you want to make sure is, or you want to try to think about is, say you are riding a horse through the woods. You do need to check those horses, mules, donkeys that you're using for your riding activities when you get back as well. Make sure that you are checking your horse daily for ticks that when you're grooming them or feeding them or exercising them, just kind of, give them a good once over, look behind the ears, in those nice little fold areas. It's really important because, of course, you don't want your horse to become ill either. So the mane, the tail, the head, the ears, work backwards to your inner leg surfaces, of course, the genital areas. And also you can use a pre or post treatment with an approved over-the-counter pyrethroid spray or a wipe-on, which will give the added protection from biting flies that your horse might crave. All right, so you do your tick checks, you use your repellents, you're being extra careful, so hopefully you won't have to deal with this. However, you do need to be aware of the signs and symptoms of Lyme disease. There is Lyme disease in our area, so don't let anyone tell you there isn't. And make sure that you are aware that if you get fever, chills, a headache, say fatigue, muscle and joint aches, or swollen lymph nodes, that you do go to the doctor if you think you may have been bitten by a tick. If you know you have been bitten by a tick, you should definitely go if you have those symptoms. However, sometimes when you get those little ticks that are the size of a pinhead or a poppy seed, you don't even know they're attached to you until they've already fallen off and wandered away. So if you've been in a tick-filled area, you've been working out in the fields or along a brush line, make sure that you are aware of the symptoms of fever, chills, headache, fatigue, muscle and joint aches, or swollen lymph nodes. You can also, of course, have the telltale rash, but the bullseye rash is only it only shows up about 70 to 80% of the time when someone has been infected with Lyme disease. And it takes 3 to 30 days for that rash to show up. Sometimes the rash will look like a normal rash. It won't have that stereotypical bullseye image to it. And sometimes some people just don't get any rash at all. Now, once you start seeing the rash, definitely head to the doctor. It might feel warm to the touch. It's not usually itchy or painful. So that's one way you can know that, oh, this is just poison ivy and I don't have to worry about it. It's just a rash, a reddish area. And it can expand over 12 inches or more across. So you may be able to watch it grow, which would be very disconcerting. Some things you may not need to worry about. If you have a small bump or redness at the site of where the tick bit you, maybe looking a little bit like a mosquito bite, that's fairly common, and it's usually just a very local infection or irritation, and it's not a sign of Lyme disease. So if you just have a little bump that looks like a mosquito bite after you have removed a tick, that's not something to worry about. However, if you start to get swelling in your lymph nodes and things like that, you do definitely want to go to a doctor. And it's really important to keep the tick that you pull off of you. Just, toss it in the freezer or put it in a Ziploc bag and date the time that you took it off of you. That way you know that how long it has been off. So when you go to the doctor, you can say, I was bit by a tick on this date, and here's the tick. And it's much easier to test the tick for Lyme disease, but if the tick is positive for Lyme disease, it doesn't necessarily mean that you are positive for Lyme disease, because like I said earlier, it does take time for that disease transmission to take place. Now, if you have gone days or months after your tick bite and you really haven't recognized any symptoms, but you're starting to get really bad headaches or your neck is really stiff, you get the rashes, the bullseye rashes a couple months later. If you're starting to get some joint pain where maybe your knees or your other large joints are starting to hurt and swell. Facial palsy is another symptom where you have the loss of the muscle tone or droop on one or both sides of the face. That is definitely a symptom. It's also a symptom of stroke, so facial palsy is always a sign to go to the doctor. Also some intermittent pain in maybe your tendons, muscles, joints, your bones hurt. And if you have a regular heartbeat, sometimes that can accompany Lyme disease. It's called Lyme carditis. And also episodes of dizziness, or if you have trouble catching your breath and you just don't know what's going on. You can then even get inflammation of the brain and spinal cord, nerve pain, shooting pains and numbness, tingling in your hands or feet, or problems with your short-term memory. These are all late signs and symptoms, which can occur for days to months after a tick bite. Now, people treated with the antibiotics in the early stages of Lyme disease usually recover rapidly and completely. Antibiotics that are commonly used for oral treatment include doxycycline, amoxicillin, or one that I cannot pronounce, so I'm not even going to try. But people with some cardiac forms or maybe the neurological things, they may require intravenous treatment with antibiotics like penicillin or the ceftriaxone. So these are things that your doctor will help you determine. But you also should make sure that you are talking to your doctor about Lyme disease. If you were out in in tick areas, you need to make sure that you are persistent and that you don't back down from asking about Lyme disease. If you go to the doctor and you have some of these symptoms, you just don't feel well, you haven't felt well for a while, and you're often in tick areas, but maybe you didn't notice a tick was on you, you still may have Lyme disease because, like I said, it's the little guys, the ones that are the size of a pinhead or a poppy seed, that are the most common ones to transfer the disease because people don't notice that they are attached until they've been on for their full feeding time and have transmitted the disease. Now, there are times where it becomes chronic Lyme disease. Now, this isn't always directly related to the infection that comes with a tick. So do make sure that you're asking a doctor who knows Lyme disease about the long-term potential symptoms and what you need to be watching for. Do be careful about taking a treatment or using something that has not been prescribed by a doctor in lieu of going to a doctor. And talk to your doctor. If you want to try a non-traditional treatment, I think that's great, but you do need to talk to your doctor about it so that they know what's going on. Sometimes the over-the-counter things can inhibit what the doctor needs to do. For instance, if you're taking a multivitamin, a B vitamin with the multiples in it, is the B complex, that's what it is. If you're taking a B complex vitamin, that can actually inhibit the ability of antibiotics to take full effect. So you need to make sure that you are telling your doctor all of the medications that you're taking, even your just plain old over-the-counter vitamins, because they all build up together. So if you want to try a non-Western medicine technique for treating your Lyme disease or for just protecting you if you think you may have been exposed to Lyme disease, do talk to a doctor still. It's very important because this is not something that you want to mess around with. And so just some quick review of the basics. Make sure that you're wearing lighter colored clothing is best. So go for the stonewashed jeans over the dark blue jeans when you're going to be out in the fields all day. Also, put your socks over your pants. No one cares if you look like a goober when you're out in the field working yourself to death. You don't want to get a tick bite. It's just not worth it. And also using a repellent on your clothes, such as a permethrin-based repellent, or using DEET on your skin. Now, DEET is not going to hurt you again. Just you do have to wash it off. Always read the labels. I mean, for any type of chemical you use, even if it's just a pain medicine that you take that you got at the pharmacy or over the counter at the drugstore, you want to make sure you're reading the label and that you know what you are taking. You know, if it says take with a lot of water, take it with a lot of water because that probably means it's going to affect your kidneys. With a lot of these spray-on things, you do have to wash them off, and that includes sunscreen. And while I'm talking about sunscreen, I do want to point out that if you are wearing sunscreen and insect repellent, you cannot put them on at the same time or they will counteract each other and neither will work. So you do need to put your sunscreen on at least an hour before going out into the sun and let it soak into your skin. And make yourself look like a mime. It will soak in. Most people do not put enough sunscreen on for it to actually work like it says it's going to work. You do have to lather it on pretty thick. And there are some really great formulations out there that aren't so slimy or greasy. And so if that's why you don't wear it, then find a better sunscreen. Once it is soaked into your skin for an hour, then you are safe to apply your bug spray. But if you put them both on at the same time, neither of them are going to work. Also, if you are getting near water, then keep in mind that the bug spray and the sunscreen do wash off with water, so you will have to reapply. So if you have any other questions about the longhorn tick or tick safety in general, I encourage you to contact me at 304-234-3673 or contact your local extension office.
Do you have questions about the COVID-19 vaccination? Do you want to know who can get it, where to get it, or do you have general questions about COVID-19 vaccines? Vaccinate.wv.gov has the info you are looking for. You can also call the West Virginia COVID-19 Vaccine Info Line to talk to a representative and find out more at 1-833-734-3673. 0965. Again, that's vaccinate.wv.gov or 1-833-734-0965 to get your COVID-19 vaccination questions answered. Thanks for listening to Extension Calling. This show is a collaboration between OSU Belmont County Extension Educator Dan Lima and WVU Ohio County Extension Agent Karen Cox. If you'd like a transcript of this show, contact us at the office. Also, let us know if you enjoy the show by ranking us on your podcast app.